Next up, we have Dr. Petti, and I'm going to see if I can learn something about the future of body shaping from a a board-certified plastic surgeon. And it's so nice to have you here. Thank you, Dr. Petti.
Good to see you, Dr. Berman.
Dr. Petti.
Yes.
What's the challenge with body shaping today? I mean, are you just getting, inundated by things off the social media? Is it everything the Brazilian butt lift? Whose tuchus are we copying this year?
I think there's a wide variety of tuchuses that we can copy, which is beautiful because you can make it individual for each patient. But there is a popular type which has a very round projection, and we can do that with liposuction, with laser liposuction, with vaser liposuction, and we can also do it with fat grafting.
Are your patients coming to you under a lot of pressure to look a certain ideal way?
Absolutely, yes.
And what do you tell you get people come in, you must look at them and say, you're perfect, you're good looking. Is it hard to turn somebody away when they've made up their mind they want to get something done?
I try not to do things that are not necessary, obviously, because some people come in and they're very close to perfect. I don't know what they're looking for, so I think there's a danger sign sometimes. You try to get a feel for what it is that's bothering them.
So where do you see everything headed? Is there a body image? Or we just kind of go up and down with we want a big butt, a small butt, or is there the Fibonacci ratio, where you have certain proportions? Are people still willing to listen to you?
The golden ratio, yes. The golden ratio, we're kind of out of the golden ratio when it comes to some of the body contours that are very popular these days. But again, we have to kind of go with the flow, what's popular.
What's the most common thing you're working on these days?
I think it's liposuction, getting it to the point where you're really sculpting it down so you have very, very beautiful anatomy, and then also complementing that with fat grafting.
What are you doing for liposculpture? Are you using energy or using?
I'm using energy. I have been using laser energy. That works really good in my hands because I'm able to get into areas that, it's difficult to do with if I can use a laser that's very flexible, I can get into areas that I can't get with a stiff cannula. Mm-hmm. And then I can also melt the fat, and I think melting the fat with the laser helps me to get a better result because I'm not fighting so hard to remove the fat, and then I can feel, in terms of sculpting, I can feel a lot more if I have it, pre-treated, pre-melted with the laser.
So are you seeing people coming in who just can't get rid of the fat, or are you getting a lot of people who just have bad diets and they need you to, jumpstart their engines?
I think, it's a variety of patients. Of course, sometimes if you have somebody who is a little bit overweight, it can give them a good incentive, because a lot of times, or it could be somebody who, for instance, just can't get rid of weight in one area. That's super frustrating, especially for women, because they may work out, but they have what I call genetic fat. It could be in their arms, it can be in their abdomen, it could be in their thighs. So it's really exciting to be able to use liposuction to give them something that they couldn't acquire any other way. So that's very satisfying for me.
Well, I remember learning liposuction years ago when it first came to the States, and it was always something we thought, wow, this is great, we'll finally get rid of this fat. Are you using fat for transfer procedures besides buttocks? Or what else are you using it on?
Also I think it's really good for enhancing around redo breast, because a lot of times, if somebody's had breast augmentation, then they have undesirable results or complications, wrinkling. If they have visible wrinkling, if they have areas that, asymmetries, and you correct that, you may be dealing with somebody who has not the best tissue because it's been worked on before, thinned down. If you have to take capsules out, then you're going to have to sometimes thin the tissue down to get the capsules out or to get rupture out. So I love using the highly cohesive breast implants that really feel very natural, and they come in different shapes and projections, which is nice to have the patient have that ability to select is kind of like going shopping, and you can tailor it to the patient and with the rest of their body contour. So maybe you're going to do a redo and they have thin tissue, then you can let them recover from the redo breast implant surgery, and then if they have any thin areas, you can do the fat grafting at that time. A lot of times I like to stage it because you don't always know what you're going to get. So you want to make it as natural as possible. So I think you can refine things sometimes if you stage it.
That's a really good point, because I think a lot of people are afraid to combine procedures, and that's an excellent procedure you can add. It'll really take you, I've seen people who are losing implants, for example, and you have to take everything out. The skin's so thin. Have you had experience with trying to improve the quality of skin as well as the subcutaneous tissue?
Absolutely. I mean, I believe even in the face. I mean, if the skin is supported, it seems to have better dermal structure than when you have loss of subcutaneous fat. It's better. So the same thing with the breast. I mean, the chest skin can be rather thick, and I think if you augment that support, then the dermis responds to that.
It's a great way of improving the dermis. On the stem cell side of things, have you investigated saving some of your patients' fat, or we have somebody coming in, and I hate the idea, you're just throwing out all these great stem cells.
I think that's wonderful. I've been using PRP, so platelet-rich plasma. So we do a lot of that, where we draw the patient's blood, and we use their epidermal growth factors and so forth to enhance their results. I have not done stem cells to this.
Oh, good. Point. We got to convert you.
Okay.
All right, here we go.
I heard you talking
Lord,
a lot about
please bring me this lovely doctor to the stem cell arena.
Okay, I'm ready.
I'll let you get in trouble with me too. Well, this is great stuff. All right, so now we got the next 10 years. Do you see any particular trends that you can identify that you think we're going towards, particularly with the kind of surgery you're doing?
Yes, I mean, I think we're getting, I love the fact that everything we're doing can be totally customized because we have so many options. So I think that, a very shapely figure that's going to stay. I don't think we're going to get back to like the Twiggy. So a lot of the techniques that we're using, to enhance one's own tissues, I think the stem cells, fat transfers, they're here to stay. And then there's going to be the ability probably someday to actually produce tissues en masse. That's going to come. That's going to come. I don't know if I'll see it, but.
So you're doing a lot of this stuff. What kind of anesthesia are you using for your procedures?
A lot of my procedures, I do a lot of redo procedures. I don't like the word necessarily botch because,
my next door neighbor films that show botch.
Exactly, but I mean, we can throw that term around. But I mean, a lot of patients do have undesirable results or complications, and that's kind of the of having a mature practice. That's one of the advantages, is they come to you because they know you're experienced. So that's what I think I'm doing a lot of that type of surgery at this time. And so it's much more complicated and much longer, and therefore, to answer your question, it's going to be under general anesthesia. I prefer that.
Well, I think most people really just want to be asleep and not feel anything.
Right.
So
I mean, if they're having major things done, it's better to reassure them that anesthesia has gotten to the point where it is relatively safe if you have a good team, meaning the anesthesiologist and the surgeon.
No, it's a really important thing. Where do you practice?
In the South Bay of Los Angeles, Manhattan Beach, Redondo Beach, Palos Verdes, Torrance.
Volleyball capital of the world, my friends.
Yes.
It's a great place to practice.
Yeah, beautiful bodies there.
Well, you know what? I'm surprised you have anybody to operate upon. You've got great bodies down there. No joke.
Yeah, but then, everybody wants a little bit better. So they show up even with those great bodies.
Okay. Well, listen, it's been a pleasure having you, Dr. Petti.
Thank you so much.
Congratulations on all your great work down in Manhattan Beach.
Thank you. It's an honor.
It's good talking to you. Thanks for coming in.